Hello and welcome. My name is Jamie Gillespie, and I am here today to talk to you about pursuing nursing specialty certification, specifically the CEN for our emergency nurses. This is a topic that I am very passionate about. There are so many benefits to achieving specialty certification in emergency nursing. Overview for today. First, let's talk about what is specialty certification, what are the requirements, how certification can impact the design and delivery of our cultural responsive care, how we can improve meaningful communication within our workplace, and how to support leadership for sustained change, quality improvement in emergency nursing. So what does specialty certification mean? Well, according to the American Board of Nursing Specialties, nursing certification is defined as formal recognition of the specialized knowledge, skills, and experience demonstrated by the achievements of standardized outcomes identified by the nursing specialty to promote optimal health outcomes. I did include the CEN exam blueprint as well. Does cover everything that you really need to know. I'm sure you know emergency nurses, we really are the jack of all trades, but masters of none. You really have to know a little bit about everything. The big pearls, the big and bad. You need to know all the big red flags regarding cardiovascular, respiratory, and neurological are going to be prioritized, of course, followed by your GI, GU, OB emergencies, psychiatric, general medicine, maxillofacial trauma, trauma in general, ocular, environmental toxicology, as well as professional issues. So what are the requirements to sit for the exam? According to the BCEN, you must hold a current unrestricted registered nurse license. You must present a photo ID, and it must be issued in the country you are tested in, which can be US, any US territory, Canada, or Australia. Unfortunately, any restriction, probation, or suspension of your license will disqualify you to sit for the exam. There are a total of 175 questions, although only 150 of them are graded. And you must score 106 correct to pass the exam. You have 3 hours to complete your exam. If you do not pass, you're given your score, and you must reapply and submit all application and pay again and retake the exam if you choose. It is recommended to have at least 2 years of experience in the emergency department. However, it is not a requirement. I will say for myself, the CEN was my first emergency certification that I got, and it took me 5 years to get the courage and the study time to take it. But most nurses with the proper know-how and ambition can work a good 2 years and study and be successful. It is worth noting that if you are an ENA member, the BCEN does give you a significant discount for taking the exam. And the discount that they do give for members is quite significant, enough that the discount is actually more than the membership. So if you pay full price for the exam, you're actually paying more than your membership costs in your discount exam. So I recommend all of our emergency nurses to become ENA members anyway, because ENA does offer lots of free CEUs as well as CEN exam prep material too, so definitely something to consider. And once you pass your exam, you are certified for 4 years. To recertify at the end of 4 years, you have two choices. You can either recertify for exam, or you can submit 100 hours of CEUs. They do have to be in emergency medicine. At least 75 of those have to be clinical, and at least 50 of them have to be from an accredited source, like the BCEN or ENA or ANCC or any accredited source. So having our nurses obtain their CEN can really impact the design and delivery of our culture responsive care. It is proven in several meta-analyses that nurses that obtain specialty certification, have lower rates of falls, lower pressure injuries, less hospital-acquired infections, less failure to rescue, and less death, to be completely blunt with you. It shows that we are prepared, we have better job performance. It really trains us to detect those subtle clues in patient deterioration and be able to respond appropriately. Um, we can really innovate that care, have better insight on patient flow, and better cultural competence as well. It really makes us emergency nurses very well-rounded and prepared for any patient encounter. According to the BCEN, board certification is a mark based on rigorous national standards that validate a nurse's specialty knowledge, skills, and clinical judgment. Nursing certification also improves our meaningful communication and our teamwork, provides a deep understanding of the emergency concepts, promotes our active listening skills, our teaching skills, our professionalism, our confidence to perform in our team, and our collaboration as well. We have structured training and knowledge to be able to effectively interact with our patients, our family, and other healthcare professionals, especially people who are from different cultures, to be able to have that mutual respect. Like I said, active listening, being able to clearly explain medical information, understanding nonverbal cues from our patients and from our coworkers. We can adapt to different listening styles and communications, and ultimately, we're leading better care and collaboration within our healthcare team. Having that mark of excellence really displays to not only your coworkers, your leaders, but your patients as well, that you are dedicated to your specialty and you really care about your job. And according to the American Association of Critical Care Nurses, specialized nurses, we really are skilled communicators. We focus on finding the solutions and achieving desired outcomes with the least amount of negative effects. We really invite and welcome all relative perspectives, even when they are different from our own. That really is how we can grow, not only personally but professionally. We grow and learn from each other and from different perspectives. We are dedicated to protect and advance those collaborative relationships with our colleagues with mutual respect and understanding. And getting your CEN, or really any specialty, is a great way to demonstrate to your leaders, to your hospital, to your coworker, to show your commitment to lifelong learning and you're dedicated for quality outcomes and quality improvement and sustained change in the emergency nursing world. We can really deliver higher quality. You are more recognized by your leaders for your excellence. Units that have more specialized nurses or certified nurses do have better staff retention. There are a lot of promotional opportunities once you get your CEN as charge nurse, preceptor. You can become an educator. There's usually financial incentives as well that the hospital will give you. A lot of times they'll reimburse your exam, or sometimes there's a yearly promotion or even an hourly rate, hourly wage increase sometimes too for getting certified. So that really just shows how much that the certification is valued. Shows your engagement, and it's really empowering as well. I would say that it can be a really big personal calling. I know for myself, just that just personal accomplishment of just being great can really be internally rewarding. Studies also show that certified nurses have higher job satisfaction and engagement and empowerment. They really are just really actively involved, very dedicated to their specialty. And as a final note, other things you should consider is that not only should you have at least 2 years of emergency experience, but you should really enjoy this. I mean, you should really ask yourself, do I see myself working in an emergency department for a long time? And do I want to dedicate myself to this specialty in the long run? do I really see myself doing this for a long time and really want to um, put in the commitment for this? Again, there are so many benefits to getting your CEN in the emergency department as an emergency nurse, but you also need to make sure that this is right for you. And I will take this time to open this up for any questions for our listeners. And thank you so much for listening. I hope every one of you check out the link I provided. Check out BCEN, become an ENA member, and good luck studying on your CEM.